We'll be dealing with a really important topic today around child care. I think everyone is fully aware that we cannot reopen our economy without, in the absence of a robust child care system, including school for our older children. But today we are going to be looking at the earlier population, the younger population, and we have an excellent group of panelists with us here today that I'm going to let my co-chair, Allison Russo, introduce here in just a second. I would like to have a shout out before we get going to Tracy Najera with the Children's Defense Fund, and Allison Paxson, who's policy fellow with the Children's Defense Fund, and Julie Horner with Groundworks that helped put on this seminar here today. So with that, I'm going to turn it over to Allison. I wish I could see her, but hopefully I'll at least be able to hear you. Thank you.
Thank you. Thank you, Senator Lehner, and thank you to all of you who have joined us today for a discussion of this very important topic. We often refer to our child care providers as the workforce behind the workforce. And we certainly have seen throughout this particular crisis, not only their value in preparing our young minds for the important developments as they are moving forward and getting ready for childhood and kindergarten, but also now we see the importance, and I think it's been further emphasized for us, their importance in ensuring that our economy can work, and particularly working parents can get back to work. So I'm so glad that we are having this conversation today. What I think this COVID-19 pandemic has also brought to light for many of us in the policy realm, beyond those of us who have worked on this issue for a number of years, is how critical it is to make sure that we have a strong child care system. It was already, I think, in crisis before this pandemic, and there are certain things that have been brought to light, I think, during this pandemic that have made some of those issues even more pronounced. So today I'm very pleased that we're going to hear from not only our partners at Groundworks Ohio to sort of set the stage for why childcare, high quality childcare and affordable childcare is so important, but also hearing some perspectives on childcare providers that are both home-based providers as well as center-based providers, and understanding particularly after this COVID and during this COVID-19 crisis, as they began to consider reopening, some of the challenges that they face in both financial challenges and making sure that they are on sound financial grounds to maintain viability in the long term, but also health and safety concerns for the long term. So I'm very pleased today. We've got three guest panelists with us. We have Lynn Gutierrez, who is from the Groundworks Ohio. And I'm sorry, I've lost my screen here. Let me get this up again so I can introduce our panelists. So we have Lynn Gutierrez, who is from Groundworks Ohio. She is going to be speaking first. We also have Mr. George Goddard, who is from the Corporation for Ohio Appalachian Development, or COAD. And he's going to talk about specifically some of the challenges in many of our rural areas for some of our home-based providers. And then also we have Mrs. Carol Haynes, who is a Central Ohio center-based care provider, who is going to talk about that perspective as well. Again, if you would hold your questions until our panelists have had a chance to have their discussions, we will open it up certainly for our legislators or the legislative aides. And then for our other audience members, if you would please use the Q&A function in Zoom, that would be helpful. So with that, I'm going to turn it over to Lynn.
Thank you. Thank you, Representative Russo and Senator Lehner and the members of the Children's Caucus that were able to join here today for having us My name is Linnea Gutierrez. I'm the Policy Director and Legal Counsel at Groundwork Ohio. And Groundwork Ohio is the nonpartisan statewide early childhood advocacy organization committed to advancing early learning and healthy development strategies during the prenatal to age 5 period of life. As the nation and our state has begun to realize very acutely during the pandemic, childcare is absolutely necessary to bolster a robust economic recovery. And without a continuum of safe choices for affordable, accessible, quality childcare, parents will be unable to fully participate in the labor market. This fundamental truth concerning our current workforce, our parents, however, has to be balanced equally with the needs of our future workforce, our kids. Our youngest children are experiencing this pandemic during the most critical period of their brain development, with 90% of brain growth happening in the first 5 years of life. Experiences during this time will provide the foundation for all of their future learning and lifelong success. So while the threat of the COVID-19 virus may be temporary, the impact for our youngest children and their families will be long-lasting. Parents and caregivers should not have to choose between work and their child's safety and healthy development. Access to safe, quality childcare is more important now than ever. So I'm just going to run through a quick timeline of events to set the stage for our conversation today. As of March 26, all childcare programs were closed unless they applied to remain in operation through a temporary pandemic license to serve children of essential workers and operate at a 1-to-6 teacher-to-child ratio with additional sanitation, social distancing, and safety measures. Closed programs received closure payments for any publicly funded child they serve based upon what a representative week of attendance for these kids looks like at their program. Pandemic programs received payments for publicly funded children of essential workers enrolled in their programs. The changes to the child care business model with reduced ratios, low enrollment, and additional costs for cleaning and sanitation in these heroic pandemic programs have been operating at a financial loss for almost a couple of months now. In terms of capacity, typically pre-pandemic, Ohio serves 117,000 children in publicly funded childcare alone. And under pandemic care, we are only serving about 25,000 children, of which only 65% are publicly funded. During this time, the deadline for Step Up to Quality, our state's quality rating and improvement system, was also extended. So programs were to be rated by July 1st, 2020, and that's been moved to September of 2020. As of March, we had over 90% of programs rated across the state, which is an incredible reminder and testament during this challenging time of the dedication of the essential childcare workforce to serving children in quality settings and meeting the needs of families in their communities. Governor DeWine announced that childcare will be reopening on May 31st. Many of the safety, social distancing, and sanitation policies will continue, and perhaps most dramatic in terms of operation costs is that while the 1-to-6 ratio has been relaxed somewhat, we have not returned to pre-pandemic ratios. Infant classrooms are at 1-to-4 or 2-to-6. Toddlers are at 1-to-6, and preschool and school age are at 1-to-9. Closure payments will stop upon reopening, and programs serving publicly funded children will receive their pre-pandemic reimbursement rates for those children. We are very fortunate to have a governor that has led the nation in prioritizing the health and safety of children, families, and the childcare workforce during this time, and has made an ongoing commitment to decisions based on the best evidence. And where the medical science and data isn't sufficient, he is undertaking a study to determine the prevalence of spread in childcare. These wise evidence-based choices and evaluations are absolutely necessary now and as we learn more about this virus to keeping kids, families, and providers safe. In order to ensure that safe childcare is available to Ohio families who need to access home-based and center-based care, it will require additional financial support. So prior to the pandemic, childcare had always operated on thin margins without many programmatic efficiencies to take advantage of and relied on a professional staff who's paid on average $10.67 an hour. Lower staff to child ratios across the board means more staff, less children, and less overall capacity based on their physical facility. That is how many classrooms they have to utilize. This means programs will have to reduce their capacity by 30 to 50%. And any programmatic efficiency has been lost as a result of these necessary safety measures, leaving little to no area for budget cuts. The gap between pre-pandemic rates and the new cost of operations is significant. In terms of spending on childcare, our normal state appropriation went to publicly funded providers in the form of a closure payment that I referenced earlier. The only new money that has come to the state to support childcare is through the third federal stimulus package, the CARES Act, which dedicated $3.5 billion nationally for one-time money through the Child Care Development Block Grant. Ohio received $117 million from this investment. Our understanding is that about half of that money went to the cost of providing pandemic care to essential workers during the closure, and the remaining $60 million the governor announced will go to a grant program to support public and private child care providers' operational costs under the new regulations. Given that $14.5 million typically goes to publicly funded child care payments each week in Ohio, $60 million will not get us far. The $60 million grant program will provide a tourniquet for programs to determine it is safe and financially feasible for them to reopen for a finite period of time. It's not enough to cover the full gap between pre-pandemic rates and new costs of operations, and it will only last a couple of months. Ohio needs to focus policy and funding towards ensuring an adequate supply of safe childcare under current pandemic measures so families can return to work and children's healthy development can be supported. We should all fear a loss of capacity. The Center for American Progress estimates that 45% of our childcare capacity, so slots both public and private, are at risk of being lost. This massive supply loss is imminent. So my ask to the legislative members that are here today is first to please protect state child care investments. Child care cannot afford to lose a dollar in state investment, but we also know that our state tools are limited. We need all of you to not only protect state funds, but use your position as state policymakers to advocate to Congress for the federal support this system needs to get us through the crisis, or else we will live with the permanent damage and economic impact for years to come. We are currently working to have a national investment of $50 billion for child care in the fourth federal stimulus package, the HEROES Act. The House passed the bill last week, and it only includes the $7 billion investment. So we need your help to build support in the House while putting the pressure on both Senators Portman and Brown that Ohio is counting on them to save this system. Please use Groundwork as your child care resource. I'm certainly going to answer questions when the panel is done, but we have published recovery guiding principles and child care considerations that are available on our website. And we can provide resources and research for you on what's happening on the ground in Ohio and across the nation in terms of best practices. We would also be happy to connect you with your constituents who are child care professionals at any time so that you can hear it from programs and families about the need in your community. Of course, our team continues to work at home, and while I hope to see you at the State House sometime soon in the future, please feel free to contact me on my cell phone or email. Thank you, and I'm looking forward to hear the rest of the panelists.
Thank you so much, Lynn. That was great information, and I know we will have lots of questions about that at the end of our panelists. Next, I would like to turn it over to Mr. George Goddard from COAD. He's going to talk a little bit about how this crisis is impacting families, particularly those living in our rural areas of the state, as well as the impact on home-based providers. George, thank you.
Thank you for having me. I work for COAD, the Corporation for Ohio Appalachian Development, and we're a coalition of 17 community action agencies. For the last couple of decades, we've been the child care resource and referral agency for the eastern and southeastern, mostly Appalachian counties in Ohio. We actually provide services in 31 counties, and it's been a lot of hard work, but a lot of really rewarding work. I wanted to say I was a little bit nervous about getting on this call, knowing that it was going to be broadcast all over the state. And I got an email today from somebody in Utah who actually was saying, "Hey, congratulations! I see that we're going to be able to watch you today." So the nation's watching what we do here today, and I think that that's probably true in a lot of cases because Ohio gets a lot of stuff right with early childhood, with the work around the Ohio Professional Registry and the state's QRIS system. That we do a lot that is really, really good. But there's a lot of work that needs to be done. I don't know, I'll echo what Lynn Ann said, that it's really important that we get this right. That particularly how we respond to this COVID-19 crisis, that we make good decisions based on good information with a deep and clear understanding of what's at stake. high quality early education gives kids a leg up, prepares them for success in school, later in the workforce. It's the primary reason that we do what we do, and I'm very thankful for everybody who's on the call, for those legislators who are here with us. You guys get it, so I don't feel the need to necessarily talk about studies, things like that. But I do have some information to share that this kind of all came about during the time period when we are doing our annual needs assessment. So we already had plans to get surveys out to all the parents that we've worked with in the past year, all the child care providers, all the community agencies that we regularly interact with. So I'll be able to share some of the information that we got from that. But before I share any data, I really wanted to specifically mention the fact that within the last couple of days, I've had personal conversations with 3 co-ed employees, and that I think of them as being representative of a cross-section of the larger population, that they're all mothers at home with children, and they're all very concerned about how we're going to open up, particularly with the idea that they don't have childcare. And even with childcare opening up, what we're hearing from the field is that not everybody's planning on opening up all at once, that there are providers who are kind of waiting to see what's going to happen, providers who aren't wanting to open up and take the chance of running in the red with reduced ratios, providers who are leery of opening up and then seeing a spike in COVID-19 cases. So they're very interested in keeping their families and their staff safe. But beyond that, even with the existing pandemic care programs, before the pandemic came along, that in 29 of the 31 counties that we identified communities that we would qualify as a child care desert, whether there were 3 or more children for every slot in an early childhood program. So that's 29 out of 31 counties. That's a pretty significant portion of the region where we just don't have enough child care. And I would say, and I can't give you the numbers on this off the top of my head, but in all 31 counties, there's always been a need for more infant care and more non-traditional care options. That, we've got a significant portion of our workforce that don't work typical 9-to-5 jobs. And this recent pandemic really highlighted some of those people, the essential workers, the medical personnel, first responders, those folks that don't necessarily work a 9-to-5 job and they can't have a 9-to-5 childcare. That's not to disparage in any way what child care centers provide, but family child care providers in general are the ones who stand in the gap here and provide that kind of care to keep families working. And I can tell you from my own experience, my wife and I operated a family child care home for 3 years. It's not an 8-hour day job. It's not even a 12-hour day job. Sometimes you're putting in 16 hours, working evenings, working weekends, doing what you can to serve the families to meet their needs so that they can go to work and bring in an income with family child care, because you're talking about reduced ratios to begin with. If you lose one kid because they withdraw or the family moves or whatever, one kid could be 20% of your income or more, depending on how many kids you have enrolled. So even minor losses turn what might be profitable into running in the red all at once. So there's not a huge margin for error there. What some of the feedback that we received that I found interesting from the surveys that we've been doing, we specifically asked community members what impacts they'd seen in their community from the COVID-19 virus, and I've got a really early copy of the data. We're still running these surveys for a couple more weeks, but it was interesting because people mentioned things like not being able to attend church services in person, and not being able to see friends and family, and dealing with illness or dealing with death in the family, dealing with anxiety and trauma. But over 40% of respondents saw the economic impact and that people were struggling. Just as many respondents noticed that there was a loss of childcare in their community, that they didn't feel like they had options. And in the survey that we actually sent to parents, the numbers are even bigger as far as what the potential impact here is. 60% of respondents said that if they don't have childcare available, they're not going to be able to go back to work. And that's huge. And that was a mix of single parents, but we can tell from the comments that a lot of them were couples that indicated that either they or their spouse would have to quit their job and stay at home with the kids. So, we've absolutely got to get this right. We've got to get it right, and we've got to do it in a way that we don't lose ground. Ohio's made tremendous strides. Lynn talked about the state's step up to quality ratings and how far we were as a state with the 90% mark. We piloted step up in the Appalachian region, and we're sitting at, I think, 93.3% of publicly funded childcare providers are rated in our region. Right now we have 26 unrated programs, and out of those, 16 have registered. Their registrations are pending. So we're really close to 100% rated, and in 15 counties we're already at 100%. And I think that that's important because of the increased reimbursement rates that those programs can get from step up to quality. That when I look at the program closures that we've had in the last 10 years, there's been a trend in program closures. In the last 5 years, family child care providers alone, and when we look at type B providers, we lost 167. But very few of those were step up to quality rated programs. 80% of the programs that we contacted to find out why they closed told us it was because they couldn't make money at it. They couldn't afford to keep the doors open. Last year alone, we lost 65 family child care providers, and only one of them was a rated program. I'd be interested in doing a lengthier study or dive into the data, but it seems like the increased reimbursement rates are helping. And of course, the work that Ohio's legislators did and worked with JFS to collapse the reimbursement rate categories, that was a godsend, and I think that impacted a lot of people as well. But it's still, we've kind of got these huge gaps in childcare, and if it gets worse, and we kind of expect it to with the pandemic, that we've heard that some programs aren't planning on reopening, and I know that JFS is surveying right now, and we expect that data to come out soon. If you're looking at places that are already childcare deserts in 29 counties, and we lose any percentage of those programs, it's going to be terrible. The impact on working families in particular is going to be extreme. So whatever we can do right now to ensure that programs can open safely, and programs can open in a way that makes sense and that they don't run in the red, I think that's what we've got to do.
George, thank you so much for that information. And, you certainly have given us a lot of things to consider and think about, particularly as this issue impacts some of our already most vulnerable communities in terms of their lack of existing childcare in many of these parts of the state for some of our youngest children, in particular, when you talked about our infants and under 3. Next, I want to turn it over to Ms. Carol Haynes, who operates a center-based care. She's president and owner of Kitty Academy, Reynoldsburg. She also has a facility in Hilliard, which is in my district. So thank you, Carol, so much for joining us.
Thank you, Rep. Russo, and all the panelists. I am glad to have this opportunity today. As Rep. Russo mentioned, my name is Carol Haynes, and I am president and owner with Kitty Academy. But most importantly, what I want to share is that I'm a nurse and an educator, but I choose to serve my community through early childhood. Next slide, please. this is just a brief photo to kind of give you an idea of where we are and what our journey has been. We started Kitty Academy of Reynoldsburg in 2011, worked with our community to build after-school programs, and currently operate 2 after-school programs in elementary schools in our area, and also own Kitty Academy of Tussing, which is located really on the edge of Columbus on the east side. And then we also have Kitty Academy of Hilliard that was opened in 2017. And here more recently in 2020, opened Kitty Academy of Downtown Columbus. And so kind of what's unique about that location is that we opened on January 20th with a soft opening. We held our grand opening on February 20th. And then on March 20th, we closed the gate and backed away. And we did not operate a pandemic center. And so we are currently closed to children and families at this location. Right now we have pandemic locations in Hilliard and in Reynoldsburg. And on average, we are seeing about 15 students a day in Hilliard, and we are caring for 95 students each day in Reynoldsburg. And I'll tell you a little bit more about why I believe that's the case in that particular area. Next slide, please. One of the things that has really been kind of heavy on my heart during this pandemic time is really that, and echoing what Lynn Ann said, pre-pandemic childcare, not only in the state of Ohio, but in this entire country, was really in crises. And the system was frail. And I think that this particular time has really revealed that we truly, really are on the fringe of disaster if we don't fund some of the initiatives that are going to stabilize our sector. And so I'll talk a little bit more about that in a second, because really what I'm seeing right now each day are students that are in food insecure homes. And so some of our students that we're seeing, yes, have essential workers as parents, but they're coming to our Reynoldsburg Academy really to eat. We serve a hot breakfast, lunch, and dinner. And we are open from 6 a.m. to 7 p.m. We did change our hours during the pandemic just by 30 minutes, but it does make a difference in our revenue, which you'll see in a bit. But one of the things that has really caused me to stay up at night, just being frankly honest with you, is the fact that we struggle with PPE. During this particular time, I think in the richest country in the world, you know, we initially struggled to get things like milk. We struggled to get cleaning supplies. And so making sure that our staff have the personal protective equipment to keep them safe is going to be important throughout this time. And so we're making sure that we're maintaining a safe environment, and we're having that opportunity to be that second set of eyes on students as well. And so we know that uncertainty brings fear and breeds fear really in staff and in children and families. And so we want to be that stability for them at this particular time. Next slide. One of the things that we've really been focused on, and let me go back a little bit. We trust the science. We trust the information that we're receiving from the governor. And so we are following the ratios. While they may not fit into our business model, we want to make sure that there's an understanding that not only in center-based care, but really across the state with family care providers too, that ratios have really changed what we do on a day-to-day basis. And our ratios drive our revenue. And so childcare is a business. We are in the business of educating children. And so we have to make sure that we're able to keep the lights on and keep the doors open and pay our commitments during that time. And so while we are really looking to adhere to these ratios and make sure that we're able to follow them, staffing costs are significant. And really when we have that decline in revenue, but an increase in staffing costs, that's just an equation that does not work. And so across the board for my businesses, what I see is that we have to have 85% utilization, meaning 85% of our seats have got to be filled, whether we're looking at our private pay academy in Hilliard, and that may be what I didn't say. We are highly subsidized in Reynoldsburg. 95% of our students receive publicly funded childcare. In Hilliard, we are a small private pay center. So we're right about 100 enrolled pre-pandemic. And then here in downtown Columbus, right really here on High Street, while our capacity is at 252, and that's a large center, we just opened it. So as you can imagine, the cost and the outlay and where we were at the time that it was announced that we had a mandated closure is significant and needs to be considered kind of as we talk through the rest of these slides. And so one of the things we're wanting to make sure is that there's continuity of payment for both rated and non-rated providers, and for publicly funded providers and private pay providers as well. What we're seeing as we're looking at these ratios is the fact that we're turning kids away. We are not going to be able to provide care. And in the two buckets that we're having some issues are our infant bucket and our school age bucket. And so one thing that we're trying to do is assess our community and say, hey, are you finding that you have space to accommodate infants? And so we've got 7 infants that we're looking to place. And that capacity loss is going to cause issues for our workforce and for families that are looking to return to work. And so access to quality care has now become even more of an issue for us as well. Next slide. As you consider this slide here, what I want to talk to you about is the fact that as we are looking at the need for increased ratios, at Reynoldsburg alone, we have a need for 32 additional staff members as we plan for our current need for students. And this is our families that are currently enrolled that have said, we are absolutely returning to work the week of June 1st. We absolutely need care. And so we need 32 additional staff members, and we're not paying folks $20 or $25 an hour. If you see this slide, this is $12.24. We've got our fringe costs included in there at 40 hours a week across 52 weeks for the year. But when we look at these numbers, we're really looking at a monthly cost for additional staff at over $90,000 a month because we are a large center. And so this summer alone, where we typically take care of 180 school agers during the summer, planning really robust enrichment activities, we will only be able to accommodate 117 school agers this year. And so those families that will be seeking care and are currently seeking care outside of Kitty Academy, they're struggling as well. And so our staff are also struggling though. And if you can imagine the stress of coming to work with some uncertainty and really knowing, am I safe? And so when my team is looking at me consistently and asking me, hey, Ms. Carroll, are we safe? They're saying that the virus can be passed, say, in stool. Is that true? And I follow up with the health department, and they indeed tell me that the virus can be found in stool, and we had not talked to them about that. That makes them a little uncertain. So there's things that continue to evolve that cause the team just to feel a sense of fatigue. We're seeing increased training costs. And so we want to make sure that our staff know and understand the strategies to keep our students safe, as well as really have the ability to keep themselves safe as well. Next slide. So for us, as we look top of business, the impact of closure in terms of our revenue implications have been during this pandemic time. Here at our downtown location, we've had a complete loss of revenue, as you can imagine, and we are not publicly funded at this particular site. In Hilliard, we've had a loss of revenue right around 85%. And as I mentioned before, our average daily attendance has kind of cycled around that 15 number each day. And in Reynoldsburg, the reason I have this highlighted is that there has been intervention for us at the state level, in that we have received closure grant payments that have helped support us. So that loss has been buffered somewhat because we've had assistance. And I think it may look a little different in larger centers versus centers that may be a bit smaller. And so I think that there'll have to be some consideration for the size of each school and academy. But in Reynoldsburg, we've seen a loss, an operating loss, but that difference is really the result of having some assistance from the state. If you could go to the next slide. I wanted to give you an idea of these slides. And so the slide on the left is our website visits, type of business, looking both at downtown Columbus, Hilliard, and Reynoldsburg. And then the right slide are our inquiries. And so these two slides are here for you to take a look at, because I want you to understand that in the middle of this pandemic, and even in as late as just April, families were not really thinking of childcare. And so enrollment is going to drive the revenue loss for providers. And so consideration of that, and that we're going to ramp back slowly, but at the same time, the number of students that we can have in the classroom is really going to impact the loss that we're seeing as well. And so we look to see slides like this trend up as we move forward, but we're going to be responsible for restoring caregiver confidence, but that is going to come from helping to build safety in our classrooms, from being able to be transparent and provide not only the staff, but families the data that speaks to if we are seeing transmission, if we are seeing infections, that we're upfront with it, we know our numbers, and we know how to combat it. And so when we're able to do that, we'll see these numbers go up. Next slide. Some of my recommendations as I close and move forward is that I am asking, I guess my ask is that the state looks to offer stabilization and recovery grants, possibly some consideration to continue that closure grant to help support schools and academies. It's going to be very important that all of our seats are available, that there is assistance for both private pay academies as well as publicly funded academies. We know that zip code really determines outcomes. We know that if there's closures, that African-American students are going to be disproportionately impacted. That also means that if we are closing seats in zip codes where we already have childcare deserts, that women are going to be disproportionately affected because they will no longer be able to remain employed. And so one of the things that we've got to make sure of is that our schools, our academies can remain open through this crisis. And so on the periphery, it's probably a little hard to see or imagine 45% of our centers closing. But if we don't manage this crisis effectively, without some state intervention, we're going to not be able to get to the other side. And so I think that that is a part of my plea at this particular time. I think one of the next recommendations would be hero pay to pandemic centers, because we have operated at a loss during this crisis, and that we also remunerate staff that have shown up every day, that have provided the care, the compassionate care to students each and every day, regardless of the information that they were hearing, regardless of hearing peers say, you can make more on unemployment. They've been present and they should be remunerated. Making sure that we can provide publicly funded care to moms, dads, caregivers, foster moms who are out of work. Previously, they didn't need publicly funded care, but now they do. They've lost their job, they're furloughed, and they need to go out or have the ability to participate in an interview, but also have the comfort in knowing that someone is providing safe care. I think essentially not providing care for parents seeking to work and asking them to leave is asking them to leave their kids at home essentially unattended while they seek employment. Also, I think to improve family accessibility to PFCC by increasing the initial eligibility, so that as parents and caregivers are seeking employment, that if they have a job that is paying a prevailing wage, that they're able to accept that position because they need childcare and dollars are tight right now. And so giving them that opportunity to be able to receive eligibility and have that eligibility be reviewed in 12 or 18 months to see if they remain eligible. But let's make sure that families can participate in the childcare that is currently available. The next consideration would be that we're not sure what's going on in the school systems. We know that something has to change and something needs to be different. And so as we look at that school age rate, to have an opportunity to have that school age rate and some policy around the summer rate carrying through the end of summer 2021. And so you may ask the question why, and that is we know that if schools decide to go to a rotation of say an A-B, and they're going Monday, Wednesday, Tuesday, Thursdays, those school agers will be in our center-based programs. They'll be with our family care providers, and there should be remuneration for the increased number of hours that students are in our programs so that we can provide care, so that we can hire teachers that can offer excellent support, strong support, whether students are bringing their own devices or whether we're providing them the device to participate in that digitally based program, whatever their district chooses, but that we are able to provide that additional support. Next slide. The additional piece that again, like I said, is very near and dear to my heart, and occasionally sometimes it really does bring me to tears, is making sure that we have a pipeline that is going to support providing our staff with personal protective equipment. This may mean a state-supported purchasing consortium that would then source or divert PPE equipment to childcare centers in every corner of the state. It needs to happen, and it needs to happen now. We cannot afford to wait until there's an outbreak in some corner of this state to provide PPE to staff. It cannot happen. We cannot delay. It needs to happen now. And in closing, really piggybacking back on really what Lynn Ann said, we have truly got to emerge from this healthcare crisis with a more robust system and have this opportunity right now to fund these initiatives, to support kids, to support families, and to support the staff that has really upheld and amplified the voice of kids across this entire state. These are our youngest citizens, and they deserve our best, and that is putting together a policy that's going to keep them safe, and it needs to happen now. Thank you.
Thank you so much, Carol. I always appreciate your advocacy in this space, and I think as many people who heard you speak, you so well articulate the needs of many of our providers across the state, and you're a great champion for them, and thank you for, again, bringing some of those issues to the forefront. I do want to make sure that in our last 10 minutes here that we open up the opportunity for some of our legislators. We have a number of legislators who are on at the moment. If you would like to ask some follow-up questions, you should be able to unmute your mic, or any of our legislative aides that are present as well. If there are specific questions that you'd like to ask our panelists, now is the time to do that.
So, Rep. Russo, this is Rep. Lightbody. I'd be very glad to seize that opportunity. Thank you for organizing a great panel, and thank panelists for coming and joining us this afternoon. I just shared in a private chat with Rep. Russo that I actually have a bill that we've drafted, and I'm going to send it out on Tuesday to ask for some co-sponsors, but it would raise the limit for federally funded support for early child care from 130, which it is now, to 200% of the poverty line. And if when I drop that bill, two things: I'm going to need some help with proponent testimony. I need some people to come and help us explain why this is so important. But also, I wonder if you have any suggestions for the specifics in the language. Is 200%? I mean, you mentioned 250%. Carol, you mentioned a different level for the very early youngest children immediately now. And I don't know, maybe it's a separate bill that would do some immediate coverage for during the COVID shutdown with all the unemployment. So what's your opinion? And I'll mute and then listen to your responses. Thank you.
Thank you. Thank you for offering that bill and to get that going. The initial piece that I mentioned is for families and moms. And so I've worked with several moms that they're looking for employment, but they're concerned that they cannot, even as employed, they cannot take care of their family on the $11 an hour it's going to take for them to meet that initial qualifying standard, as well as the way the system is currently set up, you have to have a qualifying activity in order to be able to receive publicly funded childcare. And so what I'm looking for in terms of policy is one that all parents that are currently unemployed having the ability, and I'm not sure what timeline would be able to be funded, but I think that it would be reasonable to provide them 13 weeks. And the reason I say 13 is because right now, the way that the system is set up, if a parent is currently on publicly funded childcare and they lose their qualifying activity, they receive 13 weeks of gap coverage. And so I'm just trying to look for a way to be able to help caregivers as they arrive at our school or give us a call to say, I'm looking for a job, but I need childcare while I do that. And I promise to pay once that happens, but I just need care to be able to go on an interview.
Lynn, and can you just follow up real quick and talk a little bit, when we talk about increasing the eligibility, what that means in terms of federal drawdown, because that is not entirely funded by the state when that happens, just so our legislators understand that. And then Lynn, you had talked about, one of your action items was to protect some of the state funding sources that we already have. And can you just be a little bit more explicit about what those are, which ones you're most worried about? If you could kind of tackle those two things, because they feed in, I think, to this particular issue.
Sure. So piggybacking on Carol's comments, if you all are interested in that kind of temporary eligibility during the pandemic, the state of Missouri just implemented that temporary eligibility to help folks get back to work. And Groundwork has long been an advocate of increasing initial eligibility to 200%, because even prior to the pandemic, we know that we're setting up families and have created a disincentive to go back to work. So many were taking lower wage jobs just to get access to childcare. And so, and looking, and I can share as a follow-up to this webinar with the members who are interested, we created a fact sheet that showed a family at 130% of the poverty level as compared to 200% actually had half the amount of expendable income at the end of the month when they do not have the access to childcare. So that has always been really critical. In terms of federal drawdown, the cost of expanding eligibility is up to the state. And so I will be transparent that increase in eligibility means an increase in state investment or federal investment, but we don't get additional incentives from the Child Care Development Block Grant by making a choice to increase eligibility. But I will remind Ohio policymakers that we share the not prestigious rank of having the second to lowest initial eligibility in the country. And so we're not doing what we should be for working families in that respect. In terms of my concern around state funding, again, state investment is only about less than a third of our entire child care system in Ohio. And most of it is caught up in the TANF, the Temporary Assistance for Needy Families maintenance of effort. So primarily we rely on the Child Care Development Block Grant federal funds and the Temporary Assistance for Needy Family funds for childcare. And so any increase in eligibility would be an increase in state investment. So one thing that we should point to as well is we have 20 million of our Ohio child care budget that's coming from the casino money. And one would imagine with decreased revenues and casinos being closed that we will already be facing a loss from that revenue source. But we're continue to be mostly reliant on federal funds. We have not seen the type of increase in state investments that are required to sustain this over time. And certainly with decreased state revenues are going to have to be creative and fierce federal advocates to deliver on many or all of the policies that we've shared today. And I'm happy to follow up with additional spending information. We spend in fiscal year 19, actual spending is a little shy of $750 million total on state child care, again, primarily reliant on federal dollars. And we saw a small increase, more reliance on federal dollars in fiscal year 2020 with a historic increase in the Child Care Development Block Grant from Congress. So it's high time for our state to invest, but we're at a critical moment in terms of state revenue. So we've got to make some difficult choices and prioritize our families accordingly.
Thank you, Lillian, for that. Are there other representatives who maybe have any follow-up questions?
Yes, I do, Teresa Fetter, and thank you, Allison, and good senator from Dayton. I wanted to recommend that we possibly send a letter to our Ohio congressional delegation as a group and outline these details. I think that will really help strengthen our position for the HEROES Act and really set us up for future, because I do believe we are in a crisis. We were in a crisis before with childcare, and so I think that will help position us and help with encouraging them to go ahead and pass this bill. The other thing I wanted to just alert you, there's research being done at the University of Pennsylvania's Working Dog Center at Penn School of Veterinary Medicine, as well as 2 universities in UK, to see if dogs can detect the scent of coronavirus. While this is still early in the stage, dogs are able to detect scents of other viruses like malaria. So I think that this is something we could pay attention to. It speaks to that confidence that parents need and our community needs. And if that's the case, you know, this disease in the asymptomatic stage is where we really get hit hard. And I think that's something that we could keep our eyes peeled out for. And I'm certain if it does work out, we could use some COVID money. And I can't help but think in the world of parents and families and children, whether it's daycare or schools, this could be a very useful tool in the gap of, you know, getting the virus ready to go. That's all.
Thank you, Senator Fetter. And I think Senator Lehner and I will certainly be talking after this in terms of drafting a letter. I think that that's a great idea for our congressional delegation, or to sending rather to Senators Brown and Portman on this issue. Lillian, I did want to ask you, you had noted that that the request was for $50 billion. Currently it's at $7 billion in the House version of the HEROES Act. Have you been able to estimate, you know, what amount of that would Ohio need for its providers to put us in a position where we could at least sustain current supply, if not build that? Have there been any discussions in that space about what we think we will need as a state from the federal relief efforts?
Yeah, absolutely. So the 50 million number that 50 billion, not used to talking in billions, huh? The 50 billion number national advocates came up with is based on their calculation of a 9.6 billion monthly to sustain childcare nationally. And so the methodology for how Ohio got 117 million through the Child Care Development Block Grant increase through the CARES Act would be mimicked in that 7 billion number. So you could expect about double of that coming to Ohio. But again, if 60 million gets us some of that gap coverage for a couple months, then again, we're extending it a few more months out. And it's certainly not going above and beyond to implement any of the other policies that have been discussed in terms of building supply, increasing access to families, and really reflecting backward on some of the loss that we've already sustained that will be permanent. So I can certainly follow up with a more detailed resource of the methodology in terms of that 50 billion ask. But Ohio, oftentimes when we talk to other states, I mean, serving 117,000 kids in childcare is no small feat, and certainly, advocates and the state together have done an incredible job in increasing quality across our state. But we've got so far to go, and I'm happy to get you more details in terms of how that could apply.
Thank you. I think we have time for one more question if there is another legislator or Senator Lehner, if you would like to jump in.
Rep. Russo, it's Senator Kunze.
Oh, hi, Senator Kunze. Go ahead.
I just wanted to say thank you to the panelists, and I really wanted to just reemphasize, Carol, your message at the end when you were closing in your remarks. I think it's really important for us to really think about the intentional words that you used, that we need to reimagine and make it more robust. So thank you for presenting, and I don't want to take up any more time, but I just wanted to thank you.
Yeah, I will jump in at this point to say ditto to what Stephanie just said. I think it is a question of reimagining. We can't continue down the same path we were before this. It wasn't working then. And unless we start looking at this very differently, making it a real priority in the state of Ohio, we're going to continue to struggle with this. We cannot have a robust workforce, if parents are taking time off to stay home with children because they have no other choice. And so I think appreciate all the input we've heard here today. And we've got a lot of work in front of us. So we look forward to having everyone join us in that work. Thank you.
Thank you. And I think being respectful of everyone's time, Senator Lehner, I think perfectly wrapped that up. I do just want to say we will try for the legislators who are on and the legislative aides to get the slides to you that were presented today, because there's some really good information in those slides, as well as the contact information for our excellent panelists today. And also a reminder that this was broadcast on the Ohio channel, or a recording of it will be available on the Ohio channel. So we will be able to send a link as well around, not only to the legislators who attended today, but for any who may have missed it. I again would like to thank our panelists, Linnea and Carol and George. Thank you so much for the excellent information that you presented today, as well as our partners at the Children's Defense Fund and at Groundworks Ohio. We appreciate everyone who joined us. We appreciate the work that you are doing, many of you out in the field every single day, to advocate for our children and to provide safe and healthy and great learning environments for our youngest children and our brightest minds. And thank you so much again for joining us.
Thank you for having me.